Welcome to another deep dive. Today we're going to really get into a case of canine MUO
Okay.
that has a very interesting twist. So
Interesting twist.
MUO, or Meningoencephalomyelitis of unknown origin, is an inflammatory disease of the central nervous system in dogs. And it's a real challenge to diagnose and treat as it is. But this case, it involves more than just the typical brain and spinal cord inflammation we see with MUO.
Yeah.
So let's get into it. This is a case study from the veterinary record case reports. And our patient is a 3-year-old female toy poodle. And she started having tremors, neck pain, and changes in her responsiveness. Almost like she was disoriented.
Okay, so those are all pretty classic signs that point towards problems involving both the brainstem and the cervical spinal cord.
Yeah.
Those are really important areas. They're control centers for so many essential functions.
Right. And I imagine the vets thought the same thing.
Exactly. They ordered an MRI, and it showed lesions in the medulla oblongata, which, as you know, is part of the brainstem. It's responsible for things like breathing. And there were also lesions in the cervical spinal cord.
So the imaging backed up their initial suspicions.
It did. And they also did a cerebrospinal fluid analysis, or CSF TAP, and that showed elevated protein levels and a high white blood cell count. Those are telltale signs of inflammation happening in the central nervous system.
So all signs point to MUO.
Right. At this point, it seemed like the most likely diagnosis. And so they started the dog on immunosuppressive drugs.
Okay. And how does she respond?
Initially, she responded really well, seemed like they were on the right track.
But I have a feeling this is where the twist comes in.
It is. About 8 months later, as they were gradually reducing her medication, she relapsed.
Oh, no.
And this time, the symptoms indicated that the inflammation had spread. It wasn't just in the brainstem and the cervical spinal cord anymore. Now it was also affecting the lumbosacral spinal cord.
So lower down in the back.
Yeah.
So the disease was progressing.
Unfortunately, yes. But with an increase in her immunosuppressive treatment, she did improve again. However, this was just the beginning of a much more complicated journey.
Oh, boy. I'm ready for the twist.
Okay. 6 months after that first relapse, the dog had a much more dramatic relapse.
Oh, wow.
She started showing significant weakness, pain, and neurological deficits in her hind limbs. And even more concerning, there were signs that her facial nerve was now involved.
So the disease was affecting a wider range of her nervous system now.
Exactly. They did another MRI, and this time it revealed a lesion on the cauda equina,
Okay.
which is the bundle of nerves at the end of the spinal cord. But here's the real bombshell. They also found that her left sciatic nerve was severely enlarged and inflamed.
Wait, the sciatic nerve, that's in the leg,
Yeah.
right? That's a peripheral nerve.
Right.
I thought MUO was strictly a central nervous system issue.
That's what makes this case so unusual.
Wow.
It's what makes this so intriguing. MUO typically just targets the brain and spinal cord, not nerves that go out to the limbs like the sciatic nerve.
So this wasn't a typical case of MUO at all?
Not at all.
Oh.
To investigate this further, they performed a biopsy of the sciatic nerve.
And what did that show?
Well, the biopsy confirmed that the dog had granulomatous neuritis, meaning there was inflammation in the nerve, with clusters of immune cells forming what we call granulomas. And when you combine this with the MRI and the CSF findings, it strongly suggests a form of MUO that wasn't limited to the central nervous system,
Wow.
but was also impacting the peripheral nervous system.
So this completely changes our understanding of MUO if it can impact the peripheral nerves like this. What does that say about the underlying mechanisms of the disease?
That's the million-dollar question. And it's what makes this case so important. It challenges our existing knowledge and opens up a whole new realm of questions about how MUO works.
So how did the vets approach treating this dog with such a complex and widespread presentation?
Well, given the severity of the disease and the fact that it was affecting both the central and peripheral nervous systems, they decided to go with a much more aggressive treatment approach.
Okay, so what did that involve?
They put her on a combination of 3 immunosuppressive drugs: prednisolone, cyclosporine, and cytarabine arabinoside.
Oh, wow. That's intense.
It was. And she stayed on this cocktail of medications for over a year.
Wow, a year. That's a long time for a dog to be on such strong medications.
It is. But the good news is she responded well to the treatment. Her condition gradually improved. And what's even more remarkable is that she remained stable, even after they stopped the medication.
So despite the relapses and this really unusual presentation, she ultimately had a positive outcome.
She did. And this speaks to the importance of early diagnosis, aggressive treatment, and close monitoring and managing MUO. especially in cases as unusual as this one.
So this case really throws a wrench into our understanding of MUO.
It does.
It challenges our assumptions and highlights just how much more we have to learn about this complex disease.
Yeah.
But before we get into the broader implications of this case, let's just delve a bit deeper into the research that's helping us understand MUO, even those cases that go beyond the central nervous system.
Okay, so the involvement of the sciatic nerve in this case really makes you wonder, could there be a more systemic inflammatory process at play here that we're not fully grasping?
Right.
It really challenges that traditional view of MUO as solely a central nervous system issue.
It does. And the paper we're looking at today actually mentions other instances where dogs with suspected MUO showed signs of issues extending beyond the brain and spinal cord.
Yes, there have been a few other cases where dogs with suspected MUO showed signs of what's called polyneuropathy, meaning multiple nerves were affected, for example. One study described 3 dogs that were diagnosed with MUO, and they also had cranial nerve dysfunction.
Okay, so cranial nerves control things like
Right.
facial expression, eye movement, right?
Exactly.
The things, those emerge directly from the brain.
Right. And in these cases, the dogs were showing signs like facial paralysis, difficulty swallowing, even changes in their bark.
Wow.
So it really suggested that the inflammation wasn't just limited to the brain and spinal cord.
So it was impacting their ability to control these very basic functions.
Yeah, it was. And it adds another layer to the complexity of MUO. Another study that was mentioned in the paper described a dog with GME, which is a specific subtype of MUO that also had peripheral nerve involvement.
Interesting.
This dog presented with lameness in one of its hind limbs and facial paralysis on the opposite side of its body.
Wow, lameness and facial paralysis. That's a pretty unusual combination.
It is, and it just goes to show how diverse the clinical presentation of MUO can be, especially when you factor in that potential for peripheral nerve involvement.
Right. These cases seem to support the idea that MUO might not always be confined to the central nervous system.
Exactly, and that has some pretty big implications for how vets approach diagnosis and treatment.
Yeah. Could you expand on that a little bit?
Well, it means that we need to broaden our diagnostic approach. If a dog is showing neurological signs that seem atypical, or that involve areas outside of the typical brain and spinal cord regions, we have to consider the possibility that MUO is affecting the peripheral nervous system.
Okay, so we can't just rely on MRI scans of the brain and spinal cord?
We may need to look further. Things like nerve conduction studies, or even biopsies of peripheral nerves like they did in this case with the sciatic nerve. Those might be necessary.
And would this change treatment strategies as well?
Potentially. While immunosuppressive drugs are still the primary treatment for MUO, the specific medications and how long they're used might need to be tailored depending on the location and severity of the inflammation.
So it's almost as if we're dealing with a spectrum of MUO, with some cases affecting primarily the central nervous system, and others like this one, involving both the central and peripheral nervous systems.
That's a good way to think about it. And as we learn more about the different ways MUO can manifest, hopefully we can develop more targeted and effective treatments.
This case certainly highlights the need for more research into the underlying mechanisms of MUO, if we could understand what drives the inflammation and why it sometimes targets the peripheral nerves. We might be able to develop more precise therapies.
Exactly. And perhaps even identify ways to prevent the disease from developing in the first place. But for now, the key is to stay vigilant. Keep an open mind when we're faced with these unusual neurological presentations, and always be aware of the potential complexity of MUO.
Great advice. This case really reinforces the importance of staying curious and always questioning our assumptions, even when dealing with a seemingly familiar disease like MUO. Now let's shift gears a bit and talk about the challenges of treating MUO, particularly the issue of relapse. The paper we're discussing really highlights this as a major hurdle.
Relapses are definitely a significant concern with MUO, and this case is a perfect example of that. The dog had 2 relapses, both occurring when her medication was being tapered down. It just really emphasizes that delicate balance between controlling the inflammation and the potential side effects of long-term immunosuppressive therapy.
It's a tough situation for both the vet and the owner to navigate. The paper mentions some studies that have explored different treatment protocols, trying to find the most effective way to manage the disease and minimize the risk of those relapses. Have those studies shown any promising results?
The results have been mixed so far. There's no one medication or treatment regimen that's proven to be definitively superior to others. One interesting finding, though, is that close monitoring during treatment, particularly using MRI and cerebrospinal fluid analysis, can help predict the likelihood of a relapse.
Oh, so essentially keeping a close eye on the inflammation, even when the dog seems to be doing well.
Exactly. If the MRI or the CSF analysis shows signs of continued inflammation, even if the dog isn't showing any obvious symptoms, it indicates a higher risk of relapse.
Interesting.
And that allows vets to adjust the treatment plan and potentially prevent a full-blown relapse.
So that's a more proactive approach that could really improve the long-term management of MUO.
It could. The challenge, though, is that those follow-up tests can be expensive, and not all owners can afford them.
That's a valid point. It highlights the need for continued research to develop more affordable and accessible diagnostic tools, as well as more effective and targeted treatments. But for now, I think the key is really open communication between vets and owners, making sure everyone understands the risks and benefits of the different treatment options, and that decisions are made with the dog's best interests in mind.
Absolutely.
Now, the paper also mentions that a diagnosis of MUO is often presumptive, meaning it's based on a combination of clinical signs, imaging, and cerebrospinal fluid analysis.
Right. To get a truly definitive diagnosis, especially when you're talking about specific subtypes of MUO like GME, you really need a biopsy. Ideally, a biopsy of the affected brain or spinal cord tissue.
But that's not always a practical option, is it?
Not really. It's a very invasive procedure, and it has its own set of risks. It's not something that's routinely done in dogs with suspected MUO.
So we're often left with a diagnosis of exclusion, ruling out other potential causes of the neurological signs, before settling on MUO as the most likely culprit.
That's often the case. And while this approach can be effective, it does raise the possibility of a misdiagnosis.
Yeah, that is a concern. Could you elaborate on that a little?
Well, if we're not able to get a definitive tissue diagnosis, there's always a chance that we might be overlooking another condition that's causing the neurological problems. We might think we have the right answer, but without that piece of the puzzle, the picture could change entirely.
That's a good analogy.
Yeah.
And it emphasizes the need to always be questioning and reevaluating our diagnoses, especially in cases of MUO, where a definitive diagnosis can be difficult to obtain. So this brings us back to the importance of thorough and ongoing monitoring of dogs diagnosed with MUO.
Exactly. Regular checkups, careful neurological exams, and potentially repeat imaging or cerebrospinal fluid analysis can help detect any changes early on, so the treatment plan can be adjusted accordingly. It's all about staying ahead of the curve and giving our canine patients the best chance at a positive outcome.
Absolutely. Speaking of staying ahead of the curve, the authors of the paper really emphasize the importance of early diagnosis and aggressive treatment. When it comes to managing MUO, why do you think they highlight this so strongly?
That's a great question. I think it comes down to a few key points. First, as we've discussed, MUO is a complex and variable disease. Some dogs might have a milder form that responds well to treatment, while others might have a more severe and progressive form of the disease.
So early intervention could potentially make a bigger difference in those more severe cases.
Exactly. By starting treatment early, we can hopefully reduce the inflammatory response before it causes significant damage to the nervous system.
That makes sense. What about the emphasis on aggressive treatment?
Well, remember, MUO is an immune-mediated disease. It's the body's own immune system that's attacking the nervous system. And to control this immune response, we often need to use powerful immunosuppressive drugs.
Right. But as we mentioned earlier, these drugs can come with side effects.
They can. That's why the decision to pursue aggressive treatment needs to be made very carefully, weighing the potential benefits against those potential risks.
It's a delicate balancing act.
It is. But in many cases, especially those with severe or progressive disease, the potential benefits of aggressive treatment outweigh the risks.
So it's about finding that balance between controlling the inflammation and minimizing the side effects.
Exactly, and that's where close monitoring and communication with the owner are crucial. The paper also brings up another important point. They emphasize the need for a proper diagnostic workup when a patient with MUO shows a worsening of their clinical signs, or if they develop new signs altogether.
Absolutely. MUO is so unpredictable. And relapses can happen even with treatment. So if a dog starts showing new neurological signs, or if their existing signs worsen, it's crucial to reevaluate the situation right away.
Yeah, we can't just assume it's a simple relapse. It could be that the initial treatment isn't working as well as we hoped, or it could be something else entirely.
So what would a proper diagnostic workup look like in that scenario?
It would probably involve repeating some of the initial tests, like an MRI scan and a CSF analysis. And depending on the circumstances, it might also involve additional tests, such as a biopsy of the affected area.
So it's like starting a new investigation to figure out what's driving these changes in the dog's condition. This case really highlights the detective work involved in veterinary neurology.
It does, and it reminds us that we're always learning, always trying to improve our understanding of these complex diseases so we can provide the best possible care for our patients.
Well said. This deep dive has been a fascinating look into the complexities of MUO and the importance of staying vigilant and open-minded when faced with these neurological challenges. Before we wrap up, I want to touch on one last point that the authors make in the paper. They emphasize the importance of performing an MRI of the affected peripheral nerves, especially if a biopsy is being considered.
Right. That's a crucial point, especially in cases like this one with the involvement of the sciatic nerve. The MRI can really help pinpoint the exact location and extent of the nerve involvement, which helps make sure that the biopsy is taken from the most informative area.
Yeah, it makes perfect sense. Using imaging to guide the biopsy process to get the most accurate diagnosis.
Exactly. It's all about using our diagnostic tools wisely to get the most complete picture possible.
This deep dive has been an incredible journey into the world of canine MUO, highlighting the challenges, the complexities, and the importance of staying curious and always striving to improve our understanding.
It has been fascinating. I hope our listeners have gained a new appreciation for the intricate workings of the canine nervous system and the dedication of veterinary professionals who are working tirelessly to unravel the mysteries of diseases like MUO. But there are still so many questions. If MUO can impact seemingly unrelated parts of the nervous system, from the brain and spinal cord to a peripheral nerve like the sciatic nerve, it suggests that there's a much more complex interplay of factors at work here than we initially thought.
Yeah, that's a great point. It really challenges our current understanding of MUO, and it opens up a whole new avenue of research. So if MUO can affect seemingly unrelated parts of the nervous system like this, what does that mean for future research?
Well, it suggests that we need to broaden our research focus. Maybe there's a systemic inflammatory process at play that we haven't fully understood yet. This case really opens up a whole new can of worms.
It does. The paper also mentions a potential link between MUO and the gut microbiome.
Oh yeah, that's an area of increasing interest right now in both human and veterinary medicine. We're learning more and more about how the gut microbiome, those trillions of bacteria that live in the intestines, can actually communicate with the brain and influence its function, including the immune response.
So could there be a connection between gut health and neurological health in dogs?
It's certainly possible. There's some early research that suggests there might be differences in the gut microbiome composition between dogs with MUO and healthy dogs.
Wow, if that's true. It could open up some exciting new possibilities for diagnosis and treatment.
It could. Imagine being able to identify specific gut bacteria that are associated with MUO. That could lead to new diagnostic tests or even treatments that target the gut microbiome to help modulate the immune response and prevent or manage the disease.
That's amazing. It's incredible to think that something like gut bacteria could be linked to a complex neurological disease like MUO.
It really is. It just highlights the interconnectedness of all the different systems in the body. This case study is a reminder that we need to think outside the box and explore these connections further.
This deep dive has been a fascinating journey into the world of canine MUO. We've seen how this disease can manifest in unexpected ways, affecting not just the central nervous system, but also the peripheral nerves.
Yeah.
We've explored the challenges of diagnosis and treatment, the importance of early intervention, and the ongoing research that's helping us unravel the mysteries of this perplexing disease.
Absolutely.
So before we wrap up, I want to just recap the key takeaways for our listeners, especially those in the veterinary profession. So first, MUO is more than just a brain and spinal cord problem. Peripheral nerve involvement can occur, and it's important to consider this possibility, especially in cases with an atypical presentation.
Right.
Second, a comprehensive diagnostic approach is essential, including imaging, CSF analysis, and potentially biopsies, to get a definitive diagnosis. Third, early diagnosis and aggressive treatment are crucial. The sooner we can control the inflammation, the better the chances of a positive outcome for the dog.
Absolutely.
And finally, remember the importance of collaboration and communication. Working closely with owners, researchers, and specialists is key to providing the best possible care for our patients with MUO.
Couldn't agree more.
This deep dive has been an eye-opening experience, reminding us that even in veterinary medicine, there's always more to learn, more to explore, and more we can do to improve the lives of our animal companions.
That's the burning question.
From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.